Sounds
So
good.
I'm Paul Hudson. I'm a doctor, internist, and epidemiologist. My wife and I and family have served with SIM in Africa and Asia over the last 30 plus years. Basically, love Jesus and want to see him glorified through healthcare. And I've written a book called Healthcare and the Mission of God, which is now in French, by the way. So it's cool. Mike, who's next? Dan.
Yeah, Daniel O'Neill, I'm managing editor of Christian Journal for Global Health and one of the founders of the Health for All Nations. I'm a physician, family medicine doctor, a professor at the University of Connecticut School of Medicine. I've spent some time in quite a bit of time in South America, West Africa, North India, Middle East. Um, I I'm also a graduate of Bethel Seminary of the East, a Master's of Theological and Biblical Studies, and I love to, express the living God in my practice and in world mission leadership in my church, where I'm one of the leading preaching elders there. Thanks. Good to be with you, Neil.
Hi, I'm Neil Thompson. Grew up in South Jersey in the States. Went to Thailand as a general surgeon, worked in a small mission hospital, Manaram Christian Hospital, in the central part of Thailand, which had been unevangelized in the early 1950s. I joined them in the late 70s.
Hello.
And since returning, have been very thrilled to be part of the Christian Global Health and Perspective, mainly dealing with the historical section on the 19th to 20th centuries. So very glad to be here with you.
Rebecca.
Hello, my name's Rebecca. Excuse me. And I'm a professor at California Baptist University, and I get to take students overseas on fun experiences to learn in cross-cultural contexts how to serve and use their gifts and talents and meld that together with their discipline. I happen to be a nurse, peds nurse, thank you very much. And so I helped to coordinate, if you will, the curriculum for the content that we're going to be talking about today. And I see some familiar faces on the little screens here today. So welcome.
My name is Mike Soderling, and in my former life, I was an obstetrician gynecologist and spent 11 years in Central America, primarily Guatemala. And since coming back, I have been director of what is now Health for All Nations, which has different elements to it, but have been involved in this course from the beginning. I have my MD degree, but I have an MBO, which most people don't understand because it's a made-up degree. It's a missiologist by osmosis. So I'm part of an organization that was one of the premier missiology organizations, used to be called U.S. Center for World Mission, now Frontier Ventures. So I hang around and have meetings with these people. And by osmosis, I have, I believe, become a missiologist. So I teach the last section, part of it.
Great. So Luke, yeah, it's great. Shall we jump in, Luke? We got
Yeah, let's
full,
jump in, Paul. Yep.
full court ahead. Okay. So God has a world-size role for every Christian in his global purpose. You may have heard of Perspectives on the World Christian Movement course. That's an excellent introduction to missions. This course, though, focuses on health, one aspect of that purpose. It was developed by Christian doctors, nurses, and leaders passionate about seeing God glorified through healthcare ministry. Over the last 5 years, we've offered it twice a year. It's a 14-week online course to cohorts of 10 to 15 people in the US and around the world. So the purpose, now that's the correct slide, Dan, thank you. So Dr. Dan Fountain, a medical missionary, helped inspire the course. And he said, our biomedical model of medicine is too narrow. We offer sickness care rather than health care. So we believe that a biblical perspective provides the deep connections that we need to find between the gospel of Jesus and our care for the whole person, body and soul. And it helps us to integrate our work and our practice with God's heart for the world. And so, in terms of course purpose, that allows us to give sustainable service and be effective as his disciples. And the next one, Dan. So the course is set up with readings, videos, and reflection questions, which you'll do yourself if you join us during each week before we meet as a cohort online. And during our meeting online, we review and discuss and apply and help each other learn from one another and their with the help of experienced facilitators. So you can see there are 4 sections: the biblical, historical, the cultural, and strategic. Number 1, you should be able by the end to be able to better connect the story of the Bible with ministries of health and healing. And for number 2, we're going to examine ways just how worldview and culture affect both the understanding of number 2 is actually I just missed. Number 2 is ways that God's used his people, the church, in sickness care and healthcare over history to the present day. And then we'll look at how worldview and culture affect our understanding and practice of health and healing. And then for the application more, where do we go from here? Planning effective strategies for ourselves and for the church to promote health, healing, and life. So if you're looking for a fresh perspective for your own life and calling and how it fits into God's global mission, this is your course, and we welcome you to journey with us. And so, Luke, I think Luke invited us to pray, and so I think it's great. Before we start, we're going to hear from each of these 4 on these 4 different aspects of the course. But before that, why don't we pray together? So, Lord Jesus, you went throughout all Galilee, teaching in their synagogues and proclaiming the gospel of the kingdom and healing every kind of disease and every kind of sickness among the people. Help us, Lord, during this hour to know your heart better and your calling to us as you build your kingdom around the world. And we do pray by faith in your name. Dan.
Well, the first section is the biblical foundations. We spend 3 lessons in this area. Actually, it's 3 lessons for each section. We're just going to give a brief overview. Hopefully, you'll be able to glean something from what we share, but also hopefully it would stimulate some more interest in maybe taking the course to dive deeper into these areas. The first lesson is about creation, health, and wholeness, and it's always good to start with that. That we take a creation-centered view. That when God created the earth, it was good, very good. When he created human beings, the crowning glory of his creation. That he created order out of chaos. That God was the sustainer, and he gave the tree of life for us to sustain health and well-being. And it was a picture in Eden, which is the starting point of human history, of shalom, of peace between us and God, and within ourselves, with our own true identity and purpose and meaning, and the relationships between the genders and with creation. That humans are stewards of his image, and that we steward the planet based upon God's care in creation, and that the image of the restored access to the tree of life is sort of the tantalizing story of redemptive history, that going not only going back to Eden, but looking forward to this future that we'll talk about. So that allows us in this biblical paradigm of understanding a creation-centered what health and wholeness means, so that we can feel something about what was lost when we know it was like in in the beginning of time, and also what God intends for humanity, both then and in the future, and even now. And that also allows us to envision a preferable future for each of us. We know what our therapeutic goals are because we know what God created us for. So, and therefore we align our intentions with God's intention for humanity and for the earth. The second lesson is about the fall, disease, suffering, and death. And I liken it to sort of the second year of medical school when we study pathology. But there was Eden's rebellion, which we go into fairly deeply in the sense of the rebellion of spirit agents, the rebellion of humankind, and how that led to the corruptions that we experience and we have to contend with. That there's a disordering of relationships that we have, even within ourselves, with our own personal purpose and meaning and identity, but also between the races, between the genders, between nations. And that material curses were visited upon the material creation that we contend with, and that we live, in a sense, in enemy-occupied territory. That when God breaks into human history and into our own lives, that it's a therapeutic maneuver that we'll get to in the third lesson. But we talk about the history of the people of God, the covenant community, the people of Israel that were engaged in covenants. And that's really where public health comes from, is the biblical ideas about sanitation, etc. That the law, the Torah, protected God's people from disease, suffering, and death, both preventatively and diagnostically and curatively. And that God himself we picture as the healer, not just prophet, priest, and king, but the healer, Yahweh Rapha, the one who heals. And that God is, in a sense, the source of all healing. And so this allows us to see that there are many etiologies of disease, and we go into the multifaceted etiologies of disease in a holistic way, bio, psycho, social, and spiritual. And that it makes meaning out of suffering, that through suffering, sometimes we come to our senses, or we become to feel the need for God. And that through suffering and through death and through disease, that we look for this hope beyond the grave in the future, in the new heavens and the new earth. And that gets us to the third lesson, which is salvation, healing, and mission. So the third biblical lesson describes what we're to do about it. So it's sort of like the third year of medical school and beyond. Now we're getting into therapeutics. Now we're getting into engagement with the world. And so God allows us to participate in the covenant community as believers, engrafted branches into the tree of Israel. That we live in Babylon, and yet we create Bethels, that we show up and we commune and we care for each other. And that there's an assonance in the book of Jeremiah between healing and salvation. And we look at that. And we look at life and health as a continuum in the biblical narrative, just like death and disease are in a continuum as well. And so God asks us to choose life, that we and our descendants may live. And then when Jesus arrived, he proclaimed in his hometown in Nazareth that these things were manifest in his hearing. And at the time of Jesus, he initiated a new kingdom of all nations, and that by his healing works, and we get much into how Jesus was a healer, and that the first act of evangelism and discipleship and global evangelization is love and service and care and concern and love that promotes questions to which the gospel is the answer. So healing is a reflection of the things to come. It's a reflection of God's heart and how he wants to bring his people into a new relationship with himself and others. And that it's an integral and holistic mission that we're part of. We talk about the great commandments. The great cultural mandate in Genesis is to tend the earth, to take care of it, and including our bodies. And we talk about the great commandment, to love God with all our heart, soul, mind, and strength, and the great commission, and to love our neighbor, by the way, and the great commission to make disciples of all the nations. So that's in a thumbnail sketch of the first section, Biblical Foundations, before we dive into history, which Neil will take.
Neil, I think
Neil, you're muted.
Oh, there we go. Okay. Yeah, thank you, Dan. Now we'll move from the biblical foundations to what it looked like. How did this play out in history? Imagine living 2,000 years ago, having a young child who had a high fever and then a seizure. What could you do? Where could you go? We turn to the end of Matthew 4. Read that as Jesus began to teach, preach, and heal among the villages of Galilee. And then we move through Jesus' teachings and then his practice. And we find a conclusion in the end of chapter 9. And Jesus went to visit and he taught in the synagogues, he preached, and he healed. And we're going to look at the healing part of this. Why did he heal the emotionally and physically sick, deformed, and debilitated people? Because he had compassion on them, because they were like sheep without a shepherd. And he had the power and the authority to do that. As the Messiah, he knew that his healing and these other miracles were inaugurating the kingdom of God. And he passed on this mission, this care and compassion to his disciples, and then to Paul, and then on to succeeding generations and centuries. The early church inaugurated the ministry of deacons and elders to visit the sick, to lay hands on people and to pray with them. And as early as the 4th century, Christians built institutions to care for the sick and the needy. They were called hospices at that time. In the Middle Ages, they continued institutional care and organized religious orders and civil societies in local communities. Female orders dedicated to the same ministry followed later. We wouldn't recognize these as hospital today. They were more like inns or guest houses, but providing unprecedented care for that day. The ministry of deaconesses was reinstituted in the church in the early 19th century in Germany. Compassion became the hallmark of Christian healthcare. Now, from the origins and infancy of healthcare missions, we move to how is this put into practice? Christian medical missions during the 19th and 20th centuries. Christian medical missions arose in the early 19th century as a result of pioneers like Dr. Peter Parker and Dan Beach Bradley in China and Thailand, respectively. It didn't start because committees sat down and thought, well, what can we do next? What else should missions encompass? It was because of these people who had grown in the Lord and wanted to serve him in ways that had never been done before. China had been closed to the rest of the world like forever, except for the business community among the 5 treaty ports along the coast. When Dr. Peter Parker, not the one you've seen in the movies, arrived in 1838 in Canton and began to treat people, one biographer reported, Peter Parker opened the hearts of the Chinese at the point of a scalpel. Now, he had to leave China in 1840 due to the Opium Wars. On returning to the States, he met diplomats, past, present, and future presidents, who were dazzled by his reports of this distant, enchanted country that nobody knew very much about up to that time. He became an instant hero. And even more than what he did in China, what he said and preached as he went through the cities of the east coast of the United States, and then to the UK, and then to Europe. This is really where medical missions gained traction and became known as medical missions. Today, we would call this missions mobilization. That word wasn't used in that way back then. So what were the contributions of these early medical mission ministries? The provision of medical care through the introduction of hospitals, clinics, and local community outreach, medical and nursing education, freeing women and children who were in bondage to local cultural practices, such as sati in India, that is wife burning, and foot binding in China. Within a decade, these pioneers and those who followed them were putting into practice the new discoveries of the Western medical scientific innovations, like anesthesia and antisepsis advances in the mid-19th century. These early medical ministries spread across the globe into the 20th century. Part 3, Christian global healthcare in the 20th and 21st century. After World War II, some medical missionaries got together to review and rethink the prior century of medical missions outreach. For practical reasons, hospitals and clinics had provided the delivery of most services. While noting their importance, these innovators saw the strategic nature of going out to see the people where they lived in their communities. Community and primary health care were born. At the same time, they rediscovered and emphasized that the healing ministry of the church should continue. They also stressed the necessity of preventative medicine and the importance of partnerships with other like-minded mission agencies, local church, and government endeavors. Indeed, this was a wake-up call for many nations around the world to initiate their own national healthcare plans. That's certainly what happened in Thailand, where I worked. About this time, medical mission was morphing into the broader ministry of primary healthcare, PHC. Over this time, comprehensive healthcare projects were formed by associations of former mission hospitals and local Christians, and managed by local Christians. These are some of these projects. The Christian Medical Association of India, founded in 1905. Emmanuel Hospital Association in India in 1970. Evangelical Medical Fellowship of India, EMFI, founded in 1974. The Overseas Medical Mission Center in Changhua Christian Hospital in Taiwan in 1988. The Pan-African Academy of Christian Surgeons in 2003. Africa Christian Health Association's platform, 2012. Why do I mention all these? Because this shows that what medical missions did, showed, and taught was really embraced by the nationals of those countries. And they wanted to continue the ministry in their particular ways, in their particular culture. So it's exciting to see the Ministry of Medical Missions carried on by Christian, and a lot of it copied by secular entities today. So thank you very much. This is a brief overview of the history of medical missions, healthcare missions. Thank you.
All right. So the next section has to do with culture, worldview, and health. Big topics. We could spend days and days and days on each one of these different topics, but we're just giving you a little snippet. Now, cultures around the world, we know, have differing worldviews, practices, and behaviors related to healthcare and related to how they interpret disease, how they treat that disease, and even things like, has already been brought up, suffering, death, and dying. So healthcare workers such as us and or pastors or lay people, whomever, really need to understand how to integrate that in understanding of what is culture, what is worldview, as they are sharing the gospel, if you will. So what do we mean by culture? Well, there's tons of definitions out there, but culture can be defined as those learned behaviors. So if I, let's say, adopt someone from a different heritage group, they're going to learn about my culture. So that's the beliefs and values, the reality. It influences the choices that people make about their life, about anything that we might be interacting with them regarding. Now, worldview is like my glasses. I'm looking at the world through yellow glasses or green glasses or what have you. And again, that shapes the decisions that I might make. And that's really kind of the deepest level of culture. So we know that God has called his people, all of us, to join him on his mission. That's the Missio Dei. The task really includes reaching all ethne, all peoples. And while we can't learn everything about every single culture that there is, we can definitely follow the example that Jesus gave us to love all peoples regardless. And we think about that as we think about the interactions and all the interactions that could potentially be considered cross-cultural. I would argue that every encounter as a healthcare provider, every patient encounter is a potential cross-cultural encounter because that person in front of me may have different values, different belief system, different language, different socioeconomic level. Because again, when we think about culture, it means more than just a heritage group. It can be their socioeconomic status, it can be religion, it can be occupation, and so much more. So in those encounters, as we enter into that relationship with people, we need to remember that worldview impacts their decisions. That is where cultural humility comes in, and we talk about that in our course. Think about Jesus when he was washing the feet of his disciples. I don't know how many of you have walked around with just maybe sandals or flip-flops on in some dirty areas. Maybe it's the sand, maybe it's where you have gone to serve in certain areas. Those feet would have been very, very dirty. And Jesus took that towel and wrapped it around himself and put himself in a servant's position to wash those very, very dirty feet. That's cultural humility. That's when we enter into that relationship to promote shalom in that situation. So thinking about Jesus washing his feet, that was done in humility, our approach needs to be the same. We need to enter in, there's an entry posture that we should be coming in where we're open and accepting of people, asking really good questions to find out what are their beliefs, what is their worldview, so that we can meet them. We talk about redemptive analogies, and Don Richardson wrote some great books related to finding that bridge between my culture and your culture in the gospel. And God has created eternity in everyone's heart to really find those positions. But if we come in with that superior attitude, I'm better than you, that's never going to happen. And so we really need to understand that, because we don't want to cause cultural distress. There's an actual research bit that's been done. Those of you might know when your body's under stress, there's a lovely hormone called cortisol and some other things that are activated, and it causes some physiological changes. And so if I'm not coming in with cultural humility, I am actually causing cultural distress. And so we talk a little bit about what that is. And so how can we minimize that so people don't feel marginalized and not cared for? So understanding the meaning behind some of those big questions in life, like, is there a God? Does a person believe in one God or many deities? What does that look like? What do they think happens to them at death? And so those are all things to promote shalom. We really need to understand all of those things. So going on to our next section related to culture is what are, again, diving a little bit deeper, some of the cultural factors that impact health. And so we know that in Western medicine, we often focus more on the curative measures of what's going on, whereas traditional or folk medicines focus more holistically. And so what we're also talking about in this area is we need to make sure that we're understanding, how do people behave when they're sick? Why do they behave in that particular way? It kind of ties back into some of the worldview kinds of things that we've talked about in the first section. So being able to understand those cultural factors can help when we're trying to share the gospel as well. Some of those cultural factors that we explore in this section include things like status. So when I was in China, for example, I was always given the head of the table position because status is important. And I have a whole bunch of letters after my name. And so I was given that particular status. The idea that when I was in East Africa, which was just about a week and a half ago, the little kids, as they would walk by, they would bow their head before me with the idea that I would put my hand, a blessing on their head as they were walking by. That has to do with status. I am older than they are, and so they bow their heads to those in their culture. So status is important, and sometimes we don't, and especially in healthcare, or we're talking with people, we don't understand how important that might be. So thinking about Thailand, I know some of you have been there, but when I'm greeting someone, depending on how high I hold my hands, will determine the status of the person that I'm greeting. So again, the younger children will greet me with their hands higher as opposed to a little bit lower. So status is important when we think about cultural factors, thinking about also locus of control and or fatalism. There are many cultures around the world that are very fatalistic in their view. They believe in karma. They believe that perhaps they're sick because of a curse or some kind of thing that they have done wrong, a taboo that they have crossed. So again, understanding the cultural factors of whatever location that you might be in, or if you're just in your own location and you're talking to that person that might have a different perspective, what do they believe about the reason that they're sick? Do they think they deserve to be sick? Do they think, in which case they may or may not make any choices that would help with health promotion and or disease prevention? It really helps think about fate. If they believe in fate, then maybe they are not going to take that medicine. Maybe it could be a financial piece, but it also could be because they think they deserve to be sick. So thinking through that is important. In the West, we're very individualistic in our thinking. Some of you might be from different cultures. Other cultures are more collective in their thinking. It might be more important to sit and have chai in the morning every morning at 10 o'clock in some places that I've been than starting that health clinic on time or being on time for that appointment. So when we think about all of these things, and then I've seen some questions about suffering and those types of things, we talk about some of those perspectives, but we tie it back into worldview. How does a person view their death, illness? I'll give you a quick illustration. My husband, for example, has multiple sclerosis. So when you have to go back to how do you define health and how do you define illness? He has a potentially life-limiting chronic illness, but if you ask him if he's sick today, he'll say, no, I'm fine. So how does that person define health? How do they define illness? And that's going to all be attached to their perspective on culture and worldview. And so that'll help you as you're looking at what are some of the healing practices that they might already be engaging in. And so while we might not be able to cure every single patient or person that we see, we can be a light for those that we encounter who are suffering. And that careful assessment of that worldview and spiritual needs can help provide that appropriate holistic care, that shalom that we're talking about, because we know all people are worthy of dignity and respect. So that ties into some of these impact factors related to the seen and the unseen world. Now, first, when we think about, Dan talked about the fall and some of the content related to that. But when we think about after the fall occurred, after Adam and Eve chose to disobey the Lord, three things entered: sin, resulting in guilt, shame, and fear, and of course, the subsequent consequences related to that. So when sin entered the world, we ended up with these ideas that you see here on the slide: guilt, innocence cultures, shame, honor cultures, and fear, power cultures. Now, sometimes there's some overlap between these. Guilt, innocence cultures think that there's a sense of right and wrong, and that influences the choices that people make. Again, going back to their perception of worldview and culture. Generally speaking, Western cultures are more guilt, innocence based. And this ties into the fact that most Western cultures are individualistic in their way of thinking. Now, shame, honor cultures, and some of you might have served in some of those particular cultures, exert pressure over people to conform, because the idea is that if you do not conform to the expectations, then you bring shame on yourself and others and even your country potentially. Now, fear power cultures are very interesting. They're often found in what we would call animistic cultures. And in these sections, we talk about different worldviews. We talk about a Buddhist, generally, we generalize Buddhist worldview, Hindu worldview, and some of the other worldviews. But in animistic worldviews, these are cultures that worship and fear evil spirits. They worship their ancestors. They try to appease them through food, money, and other sources, other offerings. And so understanding that context is important. And through these three concepts of guilt, shame, and fear, it's helpful to understand those contexts so that when we see a patient who has indulged in certain practices, then we're not surprised. So thinking about the seen and the unseen world kind of flows out of that, if you will. We in medicine often focus on science, what can be observed, and we're all trained in this, as we should be, right? How we can quantify, how we can measure. But sometimes in the midst of that, we dismiss what is not observed, including that spiritual world. But it's so important. We as believers, I can't put my spiritual aspect of who I am up on a shelf. It's part of who I am. And when we think about our patients, it's the same for them. It's part of who they are. So thinking about the physical needs, the spiritual needs of our patients is really important. But if we think about this in the way that many people in the West think about, we have the medical side is over here, and spirituality might be over here. Well, in a biblical perspective, we know that there's something called the excluded middle. And the excluded middle identifies and looks at what is that middle space, if you will. So the seen and the unseen world, we have the unseen world would be where we have angels, where we have prayer and visions, we have a sacred space, we have miracles that occur. And many people live in that space all the time. But in a Western mindset, we sometimes disregard that. So we need to, if we're really going to care for people holistically, we need to not take that excluded middle and just toss it out. It needs to be part of what it is that we are doing. Because a kingdom worldview acknowledges both the seen and the unseen world, acknowledges that angels dwell, miracles occur, and that physical and spiritual world are connected. In order for us to put on the full armor of God and stand firm, we need to understand that spiritual warfare is real, that there are certain things that happen in certain places that we may or may not understand, but the people in that culture might understand. And we, again, dive into some of those interesting practices. So things like sacred strings and burying a placenta, or whatever those practices are, understanding the why is going to help us meet and find those redemptive analogies so we can share the gospel, be a light to whomever it is that the Lord has put in front of us, because we know God has power over the spiritual world. God has power over death and the enemy. So we need to, again, stand firm with our armor. So a lot more on that topic, but I will pass it on to Mike.
Great, thank you. I like to think of the first three sections here as gaining knowledge and understanding of the situation presently with global health missions. And what we like to do with the last section is talk about strategy, leadership, innovations, and taking what we know and understand and acting wisely. So I think of wisdom as the practical application of what we know. So over the years, I think we'd have to acknowledge that Christians have been, at least at one point in time, the most innovative people on the planet. Now, we can go all the way back, of course, to the Old Testament, and you could certainly interpret that as the first public health document. I mean, if you read through some of Leviticus and some of the laws, it was intended to prevent disease from happening to the people of Israel. So God's word is full of practical things that, if we apply them to our lives, will enhance the health of our life. So one of the things that we emphasize in the first lesson is this idea of preventive medicine, health promotion. these elements that are so, so difficult. We have a very hard time doing this, even in the United States, because it involves people changing their behavior. And it is, for practicing physicians, especially those who have to deal with, with diabetes and hypertension and things that are lifestyle kind of choices, this is really tough. We know we have the statistics on what will help people live a healthy life, but getting them to, change what they consume and how they act or don't is supremely difficult. So, but we think that that's part of the role of the church. So health promotion and disease prevention, we believe, is part and parcel to the calling of the church. There are there's many reasons why we should be involved in research. I think we believe that this is one of the deficits in the church's outreach as far as health goes. We have been at the forefront of this. I like to say that the World Health Organization and Doctors Without Borders is catching up to what we have been doing for a couple of centuries already. So we have been the innovators. We were the ones that really were responsible for the hospital systems as we know it. Nurses, the nursing profession was started by a Christian. The Christian influence on the definition of primary health care was extremely important at Alma Ata. Some of you, if you take the course, you'll hear about 1978 and the declaration that came out, Health for All by the year 2000. Well, that meeting also helped to establish what was primary health care. And there are some very, very nefarious reasons why primary health care didn't take off as we had hoped it would. But Christians gave an enormous amount of input into the definition of what primary health care has become known as. I would go to the next slide, please, Dan. So we've talked about this already. The church in the 4th century was the innovator. They weren't hospitals as we know them now, but they were places where people received compassionate care. They were touched, they were nursed, oftentimes back to health. And so we have a precedence from centuries and centuries of this type of care already. One of the big discussions now, if you're in the global health world, is health system strengthening. And so we get into health system strengthening. What can we do as part of the church and as part of healthcare missions? What can we do to participate in strengthening local healthcare systems? There's a lot that we can do and participate in, even though they may not be believers. Dr. Dan Fountain used to say, well, Muslims get sick too, Hindus get sick too. So if we're going to care for those who need it the most, then I think we have to participate when it makes sense with other system actors to show that we're willing to participate, we're willing to partner, and we're willing to give our input into helping strengthen that healthcare system. So we often talk about identifying gaps in the church's understanding of health and where we might be able to plug a gap. And there are plenty of gaps around the world. If you've had any kind of healthcare cross-cultural mission work, you know that there are many, many gaps. Corruption steals a lot of resources that are supposed to go to the poorest of the poor. And that is one area where the church can be advocating for a just system. So there's all sorts of potential for us to become involved in this. One of the most recent ways of thinking is called systems thinking. So we talk about systems thinking and how we need to recognize that where we are, if we have a hospital or a clinic or a ministry, we are part of a system. I'm not talking about just a healthcare system. That's part of it. But we're part of this larger, some people call them ecosystems. And so recognizing that we are a player and we need to, as an important player, we need to participate where we can so that we can have influence and we can get into the conference rooms and we can have opportunities to share why we do what we do. So systems thinking is important. And, we do really promote doing research. You say you've got a good project, let us know. And, we would love to try to come up with a way for you to do research on what you're doing to prove to the world that what we do is worthy. Next slide. So finally, we go over different leadership models. You may have heard of servant leadership. Greenleaf is the big proponent of that. But we really start with what kind of leader was Jesus? And we're all well aware of the characteristics, the extreme humility, the self-sacrifice, the love that had no end. So we talk about the humility and the servanthood leadership model. We do like the adaptive leadership model. I don't know if any of you have sort of explored that, but it is a very good model because if you do it right, it forces you to figure out if the problem you're trying to overcome is something that somebody can solve that knows how to do it, or is it a complex problem that doesn't have a ready solution? Those are where you need an adaptive leadership approach, where you bring in other people, you do empathy exercises, you do research, interviews, and then you come up with potential solutions to that problem that you can try. We think that there's every reason that we should be involved in developing new strategies and practices. Best practices has been in the medical language for a long time, and the evidence-based best practices are important. But there are also, we believe there are emerging practices, some places where something is working and you may not get all of the double-blind randomized kinds of trials that give you the kind of evidence base that you think should be there, but it still is a practice that works for some. It may not work for everyone. So the last thing I'll mention is we try to very strongly make a tie between whole person care, healthcare missions, and the unreached. So it is our opinion that the church, in much of its outreach to where the church doesn't exist yet, is not taking advantage of healthcare missions or whole person care to the extent that it could. And if there is a better model for reaching people with good news, if there's a better model than true whole person care that puts Jesus at the center, then I would like to hear it. So this is part of our ethos, is the connection between whole person care, Christ-centered healthcare, and where Jesus isn't yet known. I'm done.
Well, it looked like there had been some questions related to the course format. So there is a weekly video lecture that you guys look at your own time at home in your pajamas or whatever. And there's some curriculum reading. The book, you might have seen the picture at the very beginning. I don't know if you can see my copy right here. Looks something like this. So we have the curriculum is in printed format. You can get that a variety of ways. So you read through that every week. You watch the video, and then we meet once a week via Zoom and chat and learn from and with each other, because we just like Mike was alluding to, we want to learn from what you guys are already doing. And so that's kind of a fun piece as well. So reading takes probably, depending on your reading level, about 2 hours or so of quote unquote homework. And then a 1.5 hour Zoom session. It's usually either on a Tuesday or Thursday. It just depends on fall classes are usually on Tuesdays and spring classes are usually on Thursday. And we use the Moodle platform for that. And so that's kind of what that looks like. And every week there'll be, during that 1.5 hour period of time, we talk about the content. The people that have co-authored the content come and share a little bit more. We do breakout rooms with some questions that are part of the curriculum as well. And eval at the very end. So some things that people have said about the course. They appreciate the facilitators because they know that those are the people really that are the co-authors. They like the content related to being confident as a Christian in developing their personal professional life, and or some of the people that have attended are just starting their serving in cross-cultural contexts or other locations, and they've learned some best practices in related to culture and bringing shalom. I think that concept of shalom goes all the way through our content and that holistic care. So that really is the emphasis, as I think we've all mentioned. And let's see, on the next slide, we also have learned a lot from the readings. There is some supplemental reading as part of the curriculum. They liked interacting with everyone. And I think that's what makes it a little bit different. Yes, there's the self-paced piece, but the fact that you get to interact with people is kind of a fun thing in our current day and age across the globe. We have people from all over the place. So that's a lot of fun. Anyway, that's what we have. I've seen some great questions, and pass it back maybe to Luke to see what he would like to say.
Yeah, well, first of all, thank you all. So great to just kind of get a high level overview of everything. I mean, it's clear to me just how important it is to take this course and to dive in on a deeper level wherever you're at in the journey. I mean, there's something here to, I think, for everybody on the journey of healthcare missions to take away from the content. I just love the holistic perspective. I mean, you're taking people to really some formational biblical worldview around the work that they do in healthcare missions. That's so important. And I love the things that you guys are emphasizing there. So yeah, just thank you guys for presenting it and even giving us just a little taste of what's there to dive into. Would love to open this up for the last few minutes to some questions. I know there has been some. For starters, if you haven't been following along in the chat, this is a course, even if you're non-medical, that'd be beneficial to you. Even if you're, pre-med, also, wherever you're at in your educational journey, there's not really a pre-requirement there. So let's see, there was one other question I saw in the chat that we might be able to start with, and then we can open it up to anybody else. I think it was Joel mentioned, in your experience, how have you seen physical and spiritual health intersect in practical ways? I gave an example, particularly in the realm of mental health. There are cases where biological factors like serotonin imbalances are evident, yet there also seem to be instances where a spiritual component may be involved. How should we approach or understand these dynamics? He said, I think there may be cultural component to this, like Rebecca was saying, and in the West, we do not really consider the spiritual component as much. So, you guys have any thoughts on that question?
Well, we do talk about that in the lesson. We talked about some of the cross-cultural experiences with people in certain locations around the world that will just have seizures, and they're not really seizures. They are potential spiritual possession and or some other things. And so we have some interesting conversations related to that. I think it depends on when you think about what are the definitions. Like the DSM-5 used to have some definitions related to what we call culture-bound syndromes. So I think it comes back to finding out what is going on with that patient, getting that great history and assessment, and really, as has been said a couple times in the chat, just loving that person, no matter what the cause is. But you have to figure out what the cause is, and maybe there is a spiritual component. Maybe it's just physical and some meds need to be on board, but sometimes we don't always understand everything. Paul, you came off mute. Do you have a thought?
Yeah, just that the spiritual and the physical always interact in the person. God made us as persons, and they're not separate bodies and souls. And so we're always dealing with spiritual when we deal with physical, and vice versa. It's really hard to separate the two. And we dive into the practical implications of that. What does it mean when we actually see patients? But I'll either let that for somebody else, or you'll just have to see us when you do the course.
Yeah,
Yeah.
I just wanted to mention too, we do have we've had guest speakers that have dealt with spiritual warfare. We've had one one of our guests was from Africa. He was speaking about the African cosmology and the spirit world and so on. So we do discuss that.
Neil, I think you had something you wanted to add in there.
Yes, I just wanted to point out that a number of people have taken this course over the last couple of years who specifically wanted to be able to adapt the material for their cultural and country context in several places around the world. Maybe some of the others would like to comment on this.
All right.
No, I think that's an important piece. We do, I don't know how many people on the call are from other cultures around the world, but if there is enough interest generated, and we're very, very interested in seeing contextualized versions, especially in the culture section, obviously. But yeah, we'd love to do that.
Yeah, to that end, I may be able to take a look at some of the demographics of people in attendance from those who registered to give you an idea of different parts of the world, people who registered for tonight. Might be helpful to you guys. Yeah, anybody else have any questions they wanted to jump in with here? Got a couple more minutes.
So one thing that hasn't been asked that probably is something to consider is, how much do you charge for this course?
Yeah, I'm in. I would like to share some of the things that are, yes, the point that you mentioned, like the cultural humility and the distress and the definition and this concept related to culture, they are very, very.
Yeah, I think we might be losing you there. We'll give you a minute to get to better reception there. But Mike, you mentioned you were bringing up cost of the course there.
Very much important. That's what those ones related.
Mike, go ahead. Sorry about that.
Yeah, it's traditionally, because we're kind of a startup, maybe not so much anymore, our request has been for, and this is only a request, is for a $150 donation towards our sustainability. Now, how long that lasts, I don't know. For people that can't afford that, we do allow for that. But I would say in the future, as we progress into our setting within William Carey International University, the fee will go up. But as it stands now, we're still at this $150 participation donation. So that's all I can say right about at this point in time.
Great. Yeah, very helpful. I appreciate you bringing that up. And Mike had put it in the chat a little while ago, but you can find the course. Can you maybe just say the website? I don't have it off the top of my head. Oh, it looks like cghiperspective.com. Is that correct? cghiperspective.com. That's where you guys can find the course.
Yeah, I put the link in there twice.
Good. Okay. Awesome.
Yeah. Kathy, your question about how do you find an organization to serve with it isn't something that we actually address in the course. The people that participate, that are teachers and facilitators, have considerable experience and exposure to multiple organizations, and people from multiple organizations have taken the course already. So the most I can say is that we would have suggestions and options based on our own personal experience.
Yeah, and I'd add to medicalmissions.com might be the best friend in terms of finding an organization. If you go to the organization directory in medicalmissions.com, there's hundreds of organizations in there.
Not to mention going to the GMHC.
That as well. Yeah, that's a great place also to meet people through the exhibit hall and find people that connect with your skill set, areas of the world you're interested in, and things like that. But it's a good place to find a good match. There's also an e-course on medicalmissions.com right now that will kind of guide you through the process of finding your best fit sending agency. So there's a lot to consider as you're considering going. And so we would recommend taking advantage of some of those resources that are available to just help you think through all the different facets of preparing to go and finding the best fit sending agency for you.
I would just say, I think this course kind of prepares you to discern that type of decision making in terms of which course to go with. So it gives you a very deep kind of sense for what you'd be looking for in an organization.
Absolutely. Yeah. All right. Well, I want to respect everybody's time. So we're at a little bit past the top of the hour here. So just want to thank you all for coming. I'd love to close in a word of prayer. But I don't know, maybe Dan, how do you feel about closing this out in prayer?
Sure. Be glad to. Father in heaven, we just thank you so much for your presence in the world, your work in our lives, the way you've impacted the world through your servants over the years, and we rejoice in the way Jesus healed. We follow his example, and in fact, he leads and guides us and lives within us, and we thank you for that. So we're not just left on our own, Father, and you've given us strength for the battle and through the challenges that are before us. We thank you for the wisdom and knowledge of people who go before us, who have been tested and time tested in the crucible of ministry. And we just pray, Father, that you would allow us each to grow in the grace and knowledge of our Lord Jesus Christ, and to be emissaries and ambassadors for you wherever we go. We live, move, and serve and have our being. That you would be glorified in all the earth, that the nations would be healed, and that you would be pleased in all that we do and say. In Jesus we pray. Amen.
Yeah.